Starting tomorrow, tens of thousands of patients will either lose or pay more for their Canadian dental care plan coverage. Health Canada says an error led to 43,000 patients being approved for an inaccurate co-payment level. Another 27,000 Canadians were approved for the program despite being entirely ineligible for coverage. And while Health Canada says it rectified this error, the mistake is raising questions over how the dental care program is faring and what its future looks like. For more on what is happening right now at the CDCP, we are joined by Dr. David Brown. He's the president of the Ontario Dental Association. Good morning.
Morning, Anne-Marie. Thank you for inviting me today.
I'm so curious how this happened. I went through that statement a couple times yesterday, and I was trying to figure out what was the error and how did it happen. We'll get to that in a moment. But first, to remind everybody, eligibility for the dental care plan depends on your family income. So 100% of treatment costs are covered for patients with incomes that are less than $70,000. 60% of costs are covered for those that earn $70,000 to $80,000, and 40% of costs are covered for those who make $80,000 to $90,000. These requirements were announced a couple of years ago, 2023. So what led to the error? If it's a threshold, you either make it or you don't.
Yeah, I think it's one of those situations where the program was rolled out very quickly with maybe not a lot of the details ironed out beforehand. And that was a concern to the dentists, the organizations across the country, and that plan that's put together too quickly can be leading to problems later on down the road. So we raised this with Health Canada, our concerns. One of the things to keep in mind is the coverage that you referred to is of what the government will pay. There's the customary fee for the dentist would be above that. So there is a different area that needs to be covered beyond the federal fee grid. But I think it just reflects the lack of communications, the lack of details that Health Canada put towards advising the individuals that are under this care. And I think it's a good plan. It just needs to be worked on and details need to be sorted out.
Health Canada says ineligible patients, so those who were discovered in this error and they received coverage before tomorrow, they're not going to be required to repay for the care that they received. And this is according to Health Canada. 28,000 patients have already received care that they're just not eligible for. So what will the government's error mean for these patients going forward?
I think the important thing for these patients is to reach out and check their eligibility when they're going to the dentist. Make sure that they have a clear understanding of what their coverage will be like. And dentists are trying to work with Health Canada. The challenge right now for dentists in their offices, the administrative issues. There are so many levels of insurance information that needs to be sent in to check for eligibility, and it's important that the patients understand their coverage before they go forward. So it's part of the communications that the government needs to be sending out to these individuals. So there's no surprises when they get to the dental office.
This is a federal program, so I want to put it in context of the budget that is coming out on November 4th. This summer, Finance Minister François-Philippe Champagne ordered every federal department to find a 15% savings. So when asked if dental care could be affected earlier this month, the health minister said, still moving on. So how secure do you feel about the future of this program if the Prime Minister has asked in this new era of Canadian economy and what we're living in to find savings in all government programs?
We're definitely concerned about the sustainability of this program. When it was originally announced, the cost was a lot less than what it is at this point in time. Right now, it costs about $900 a patient to go through the plan. That's how much the patients are saving. So I think the government needs to look at it and develop a plan that will be sustainable long-term. We are concerned. We suggested to the government to take their time. Don't roll it out too quickly. Let's look at the details, make sure it's going to work, and get the administrative issues taken care of before they roll it out. And we are concerned about either cutting back on the eligibility of patients in the future or just what the benefit would be for these individuals. Another concern is the de-insurance risk. If small employers are looking at the CDCP as a way of cutting their private plans and having their employees go onto the CDCP, it's another issue that will be raised and increase the cost of this plan going forward.
Well, so that's what I wanted to ask you about. Is it possible then that when the government put this plan together, the miscalculation is the fact they didn't realize how much it was going to cost per patient, meaning it became more expensive than what they planned for? And is this a way to control those costs?
I think the initial costs were definitely underestimated. We've put together some options for the governments over the last few years, and we've tried to encourage them to follow these options. Dentistry is run a little differently, and it's a situation where dentists understand the most of how a practice works. They understand what the patient's needs would be, and working with the government is very important, and we just want to make sure we have that ongoing dialogue. We've suggested other options that they could help control costs, maintaining the accessibility for the patients, because that's really the care that we need going forward.
Dr. David Brown, president of the Ontario Dental Association, I appreciate you coming on this morning. Great to have you.
Thank you very much, Anne-Marie.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.